Hi everyone. So in this final part of the presentation, I want to tackle the question, where do we go from here? So it's clear that whilst the nurse-patient relationship and its measurement continue to be a really central topic for exploration, this doesn't seem to be matched by the rigour with which metrics around the relationship are actually being developed and refined. And this lack of rigour and the lack of consistency in terms of how the relationship is conceptualised and how it's measured, it doesn't appear to reflect the recognised importance of this relationship, both for patients and their families and for nurses as well. So if the nurse-patient relationship is to retain its place as the hallmark of nursing practice, then more concerted efforts are required to actually research this relationship rigorously and systematically, identifying its conceptual parameters and its measurement properties, and then understanding how these can be incorporated into nursing documentation and other measures for the nurse-patient relationship. Otherwise, the perceived value that we place on the relationship is at risk of becoming mere rhetoric. So, what are some avenues for future research? It's clear from the existing research that rather than creating new additional instruments to measure the nurse-patient relationship, research efforts do need to focus on synthesising and building on existing instruments and what already exists so that we can actually start minimising some of the current duplication and variability within the literature. And of course then make it easier for people to decide which instrument is the best for their specific purpose. So we need to focus on developing coherence around the nurse-patient relationship, working to generate a concept that has clear conceptual boundaries. And that includes understanding whether procedural or technical aspects of care should be incorporated into conceptualizations and measures of the relationship. We also need to determine whether there is that foundational set of behaviours required to develop and maintain relationships that can be assessed across contexts and patient groups. And of course, patients and nurses, at the very least, must be actively involved in developing and refining these core behaviours that underpin the relationship and which will then inform measurement. We also need to explore the feasibility of moving beyond dyadic interpretations of the relationship and towards more dynamic conceptualizations of the relationship that involve multiple actors, including the wider healthcare team, patients' family members and carers. And finally, we need a consistent approach for conceptualising and measuring patient behaviours and involvement in the relationship and how that inevitably influences nurses' behaviours and relationship development. So together these areas of research will help us to identify consistent behaviours that reflect the most important elements of the relationship, as well as guidance on how those elements are best measured. And of course that will help to enhance the accuracy and validity of findings obtained from those measures. So briefly, I want to give you an example of a study that we are conducting here at Flinders University, which is aiming to tackle some of these issues around conceptualising and measuring the relationship. So we are using a novel method called story completion to understand how nurses, patients and their informal carers, so for instance maybe a family member, how they conceptualise caregiving relationships. So story completion is a method where you provide participants with an ambiguous hypothetical story stem. So that's like a story beginning. And then you ask the participants to finish the story. So the idea is that participants will draw on their common conceptualizations or ways of understanding the world to write the story. And because they're asked about a hypothetical situation and hypothetical characters, they won't necessarily be constrained to writing about themselves or their own experiences, although we often expect them to draw on those experiences when they're writing the story. So in our particular study, we have asked participants to write a story in which a health professional and a patient meet and develop a good relationship. And then we then ask the participants to describe in their story what that good relationship looks like and how and why it occurs. And some of the story stems focus just on a nurse and a patient, And then some also focus on the health professional, the patient, and an informal carer. So by doing that, we can get a sense of how these different groups conceptualize the relationship when a carer is involved and when they're not involved. So in generating this evidence, the voices of patients and nurses will be appropriately represented, and they'll be put at the forefront. And we'll also begin mapping that inherent complexity of the relationship as it occurs in healthcare, so inevitably when more and more people become involved in that relationship, like a carer. And in doing so, we will be able to better inform the development of educational and practice-based interventions. And of course, we will have the evidence that we need to actually refine measures of the nurse-patient relationship and better understand how that relationship can be measured as part of routine nursing documentation. So that brings me to the end of this keynote presentation, and I want to thank you once again for inviting me to speak on this important topic. And I'm very open to discussing ways in which we might be able to collaborate and do the vital work that needs to be done to ensure we can appropriately document the nurse-patient relationship. And just before I go, I encourage you to consider this final set of questions as well. And these questions really focus on what might documentation look like in practice and the challenges and opportunities we face in ensuring that this documentation can actually happen. So thank you once again.